Hello everybody, I'm Dr. P. N. Renjen. I'm a senior neurologist at the Indraprastha Hospital and I look after stroke services at the hospital. 29th of October each year has been marked by the World Stroke Organization as the World Stroke Day. This year's theme for the World Stroke Day is Up Again After Stroke. I would like to start telling you, first of all, what is a stroke? A stroke is a sudden brain damage which is caused by a lack of blood supply to the brain caused by a clot or rupture of a vessel inside the brain. A clot is called an ischemic stroke, where the clot occludes an artery supplying blood to the brain, which accounts for about 87% of all strokes. The second type of stroke I'll call the hemorrhagic stroke, which account for about 20% of all strokes, are of two types. If an artery bursts inside the brain, it's called the intracerebral hemorrhage. If there is a blood in the coverings of the brain, it's called a subarachnoid hemorrhage. Now, there's been a lot of interest on the risk factors of stroke. Broadly, we have modifiable and non-modifiable risk factors of stroke. The non-modifiable risk factors of stroke are genetics, age, sex, of which you and I can do nothing about. But we certainly can treat, can modulate our modifiable risk factors of stroke, which include diabetes, blood pressure, hypercholesteremia, and now we are getting a lot of interest of stroke and pollution. In a developing world like ours, pollution seems to be a very important cause of stroke, and hence there is a subsequent increase in the stroke incidence in the developing world. We all know the incidence of stroke is rising in the developing world, and India is one of them. Why is it happening? It's happening because of the increase in population, increase in life expectancy, rapid urbanization from migration of villages and small cities to the major cities, changing lifestyles involving sedentary habits, smoking, alcohol intake, and of course rising stress level in life, which adds to the increasing incidence of stroke in the developing world. It is very easy and it is very simple to know the symptoms of stroke, and as a layman also to find out what are the symptoms of stroke. Any sudden onset of severe headaches, trouble seeing from one eye or seeing a double vision, sudden confusion, trouble speaking, sudden weakness or numbness of one half of the body. I would like to stress upon the fast. Stroke strikes fast, F-A-S-T. Ask the patient to smile. The side of the stroke would come down. Ask the patient to raise both the arms and ask the patient to speak, to look for any alteration in his speech. If you observe any of these symptoms, rush the patient to the hospital, because stroke is an emergency. We have no time to lose with these patients. Please do remember that it is not always that the stroke comes out of the blue. 40% of patients who have warning signs of stroke have a stroke. So it is important for us to pick up the warning signs of stroke. I would like to tell you very clearly that all the perceptions of strokes, the myths of stroke, the realities of stroke Unfortunately, all the myths of stroke are not correct. Stroke is not preventable is a myth. Cannot be treated is a myth. Only strikes the elderly is wrong. Happens in the heart, wrong. Recovery ends after 6 months, wrong. So, if everything that is said is just wrong, what is the reality? The reality is that up to 80% of strokes are preventable. Stroke requires emergency treatment. Anyone can have a stroke. Stroke is a brain attack. Stroke recovery lasts for a lifetime.